Okay, welcome everyone. My name is Raphael Landovitz from University of California, Los Angeles, and I'd like to welcome you all to this IAS-USA mini course on keeping up with the guidelines, recommendations, and controversies in sexually transmitted infection management. We're really excited to have this opportunity to have this interactive course with you all today in the current environment where resources are increasingly scarce and difficult to find reliable sources of information at a moment where the sexually transmitted infection epidemic continues to grow in the United States and globally. It's really important to have opportunities to interact with experts and trusted sources to get information. And we hope that this course will be a source of such information and discussion for you all today. So thank you for joining us. On behalf of my co-chair for this course, Susanna Naggie from Duke University, and again, if you missed me saying it, I'm Raphael Landovitz from University of California, Los Angeles. We're delighted that you could be here with us today. We are going to be together for about 4 hours and 45 minutes, so hope everyone is well hydrated and osmo-regulated. Again, we'd like to welcome everyone to today's course. We do have approximately 190 attendees registered, and the registrants are from all over the United States, as well as Aruba, Canada, Chile, Colombia, Ghana, Haiti, Mexico, and Singapore. So really exciting to have global representation. Many of you, and thank you to those of you who completed the pretest assessment, which we think is really a valuable source of how we're doing in terms of the teaching component of these conferences. Those of you who took it, only 15% of you passed. So I actually think that that's a great statistic because it means that there's a lot of new or nuanced information that we'll have a chance to go over in today's presentations. And hopefully, when you do the post-test assessment, after taking the course, we'll have a substantial amount of demonstrated new knowledge. So I think this is actually a terrific statistic, even though you might think it's a little scary to look at. Just to remind you, this course is accredited for continuing medical education credits. It's designated for up to 4.5 CME credits across the various continuing education platforms. The information for how you claim that credit will be available after the course on the IAS-USA website. So again, hopefully a great opportunity for you to get those credits as well. In addition to the registration fees that you all paid to join this course, IAS-USA does get support from a number of industry partners, including Gilead, Merck, and ViiV, and so we're very grateful to them for their support. As part of any CME activity, those of you who have done such activities in the past are well aware there's a whole review process to ensure the scientific integrity and non-biased approach of all of the presentations that you will be hearing today. Before each presenter begins their presentation, they will disclose their relationships with what are now called ineligible companies, which is what we used to call commercial interests. So that will be displayed on a separate slide, so you'll be aware of any potential biases. I'll now turn it over to my co-chair, Dr. Naggie, who will go over some operational logistics about going through the course, and then we'll jump right in.
Thanks so much, Rafi. And I'll just echo the welcome. Really looking forward to spending this time with everyone here. So again, this is now just going to be a lot of housekeeping. So Zoom features, we're going to be using a Q&A function for this. So please do not put questions in the chat function. We want you to use the Q&A button. And when you do that, please include your full name and institution so that as we go through the Q&A, we can make sure that we recognize folks that are asking the question. And then also we are going to have some audience response questions. And so when a question is posed by one of the speakers, there will be a polling question window that pops up. Once that pops up, please feel free to participate in that. It actually is really helpful and fun to have a more interactive experience. And then we do want to welcome fellows. Really thrilled to have our future scientists and clinicians and others involved in this learning event today. So in terms of the agenda, as Rafi mentioned, we're going to be together for almost 5 hours. So we're really looking forward to it. We have a number of fantastic speakers. I personally am looking forward to being a learner for the majority of this as well. We will start off by focusing on drug resistance, resistant gonorrhea, and then move into management of chlamydia with specific focus on advances, including vaccines. We will move then into preventing and managing syphilis in this current time, which I think we all know has seen significant increases in this communicable disease. Then we will turn to hepatitis B in people with co-infection, really talking about in particular some of the challenges that we are all experiencing as we are shifting to long-acting injectables that do not include hepatitis B active therapy. And then we will talk about pre-exposure prophylaxis, particularly emerging data that and approvals that we've seen here recently. And then ending on, I think, a really critical topic, particularly given the recent update to guidelines regarding the screening and treatment of HPV-related malignancies, particularly anal cancer. All right, so that I think is a summary of where we are in all of our housekeeping. And so we're going to move now directly into our program. And I have the pleasure of introducing our first speaker.